My name is Liam Despard, and for my paper presentation, I did ketamine therapy for patients with treatment-resistant depression. Depression is a significant challenge in the daily lives of millions of people. The treatment methods of this disorder vary substantially. The traditional approach to alleviating depressive symptoms is through a mixture of talk therapy along with a prescription of antidepressants. However, this approach is not always effective. This is called treatment-resistant depression, or TRD for short. When a patient is afflicted by TRD, the method of treatments are scarce. The FDA has only approved 7 non-pharmacological treatments for TRD. Due to this, there's been a plethora of research and development into new ways of treating depression. Ketamine therapy is of great significance to the advancement in alternative ways of treating depression. The addition of ketamine to potential treatments for TRD will open doors to the study of other non-conventional treatments. A multitude of studies have found that ketamine treatment is helpful in reducing the severity of TRD, but the correct dosage to maximize this antidepressant effect is unknown. Researchers Marizo Fava, Marlene Freeman, Martina Flynn et al. In the paper Double-Blind Placebo-Controlled Dose-Ranging Trial of Intravenous Ketamine as an Adjunctive Therapy in Treatment-Resistant Depression set out to discover what specific dosages was optimal for depressive symptoms reduction. An important experimental design factor of this study was that it was a double-blind, placebo-controlled experiment. Researchers planned on administering various doses of ketamine to patients with TRD and already undergoing antidepressant therapy, or ADT. There was a washout period for patients that were taking prohibited psychotropic medications for the chance of an interaction with the ketamine. 99 subjects consented to this study. They were all between the ages of 18 and 70 years old, diagnosed with major depressive disorder, and were experiencing a depressive episode that has lasted longer than 8 weeks. Subjects were divided into 5 separate groups. 4 groups were administered ketamine intravenously, and 1 group was administered midazolam intravenously as the placebo. The first ketamine group received injections of 0.1 milligrams per kilogram. The second received 0.2 milligrams per kilogram. The third group received 0.5 milligrams per kilogram, and the fourth group received 1 milligram per kilogram. The placebo group was administered 0.045 milligrams per kilogram of midazolam. The subjects were administered injections over a 30-day period. The results of this study show that the doses of ketamine at 0.5 and 1 milligrams per kilogram are superior to treating depression compared to the midazolam placebo tests and doses of ketamine 0.1 and 0.2 milligrams per kilogram. Only the 0.5 and 1 milligram per kilogram doses of ketamine were statistically significant. With higher doses of ketamine, there were more side effects presented in patients. The higher the dose of ketamine, the higher the average blood pressure of the patient. For each dose of ketamine except for 1 milligram per kilogram, there is a rapid loss in efficacy after 3 days. For the 1 milligram per kilogram dose of ketamine, there was a longer lasting effect observed, lasting roughly 15 to 30 days total. Ketamine-treated patients also had lower scores on the HAM-D6 test, a test which measures depressive symptoms. The lower the score, the less depressed. However, in a self-reported survey, there was no statistical difference in suicidal thoughts or ideations for participants involved between the placebo group and the ketamine treatment groups. One of the limitations of this study was the sample size. There were between 10 and 20 participants in each group, which is very low. Another flaw is that there was a functional unblinding that occurred due to the observed effects of the ketamine. This research is a major step forward in clinical knowledge and treatment of mental health disorders. It shows that participants and researchers are willing to experiment with various substances. This is also a leap in alternative treatments for TRD, which plagues millions of people daily. While the authors claim that ketamine could potentially be a groundbreaking treatment, they are still cautious about mainstreaming ketamine therapy. There is still much more research needed into ketamine, especially the long-term effects. Despite all of this study still shows the promising results that could advance the clinical treatment of depression in the future.